Hello everyone, my name's Dr. Judy Putt. I'm in the Department of Pacific Affairs at the Australian National University. Welcome to our Department of Pacific Affairs research seminar today. Before we begin, I'd like to acknowledge the traditional custodians of land and water here in Canberra, where I am. It's the Ngunnawal people, but also the custodians wherever you may be. So we've got a great event today, really looking forward to it. Our presenter will discuss the course of the pandemic, the COVID pandemic, in case you're confused about which one, in French Polynesia after the reopening of French Polynesia's borders in July 2020. The presentation, which will be given by the journalist Nic Maclellan, will discuss commonalities and differences between French Polynesia and other island nations. And I won't say anything more because he's eager to start, I suspect. But Nic is a correspondent for Islands Business magazine. He reports widely on French policy in the Pacific and is co-author of La France dans le Pacifique, de Bougainville à Mururoa. Now, excuse my French pronunciation. You can tell I didn't do very well when I learned it at school. And the other book he co-authored is After Mururoa, France in the South Pacific. I would ask you to put your questions or comments in the Q&A box at the bottom of your screen, and I will read them out at the end of the presentation, or Nic may just directly answer them himself. And I just remind you before we begin that this session is being recorded. Okay, Nic, if you're ready to go, we'd love to hear your presentation.
Judy, thank you very much. Thank you very much for the invitation from Department of Pacific Affairs to present today. I'm speaking to you from Naarm, from Melbourne in Australia, on the land of the Wurundjeri people of the Kulin Nation, land that was never ceded. I want to talk today a lot about the global COVID-19 pandemic in a particular context, that of the islands of French Polynesia within Australia, when there is analysis and reporting about COVID within the Pacific Islands region. There's a particular focus on Fiji, where there's been a major surge, particularly of Delta variant of the virus in recent months, and also the looming crisis in Papua New Guinea, which has very low vaccination rates and a significant looming health crisis, given the logistics and difficulties of mounting vaccination and response in Papua New Guinea. But there's much less talk about what's happening in New Caledonia and French Polynesia, which is surprising, given the significant changes in Australia's relationship with the French dependencies in the Pacific in recent years. In 2016, French Polynesia became a full member of the Pacific Islands Forum, the regional political organisation. French Polynesia is a member of other regional bodies like the Pacific Community and SPREP. Australia recently established a consulate-general in Papeete, Tahiti, as part of its step-up, so-called, to the islands region. And anyone who's been reading the papers in recent weeks will know that Australia-France relations within the framework that's dubbed the Indo-Pacific is a central issue of domestic, regional, and indeed global geopolitics. So today I want to focus on climate change. If we can share the map of French Polynesia. French Polynesia is a country of about 280,000 people in the Eastern Pacific. It's 5 archipelagos spread over a vast area with the capital, Papeete, on the main island of Tahiti. Tahiti and Moorea, the major population centres in the Society Islands. But it's a 1,500 kilometre flight to Hivaoa here in the Marquesas, the outlying Marquesas Atoll, the Tuamotu Gombier Atolls, Australs. It's a large area spread over 5 million square kilometres of ocean. And that has implications for the provision of services, access to healthcare, and other areas related to this in the current pandemic. I've been involved in reporting on developments in French Polynesia for many years, but have a particular focus on the situation at the moment in the context of ongoing debates about French Polynesia's political status and development opportunities because of COVID restrictions. I was due to travel there last year and again this year during the visit of French President Emmanuel Macron, who visited in July. Unfortunately, because of COVID restrictions, was unable to do so. But I've been working with colleagues on the ground, including a wonderful photojournalist, Sulian Favanek. I want to acknowledge her cooperation as part of our research, and particularly her photos, a number of which I'll be using today in the presentation. And to start off, I want to present the next photo of Hina. Hina is a young woman in Tahiti. She is a mother of a young 6-year-old. And in October last year, she was literally making a cup of tea, left the gas on and forgot about it. And it was only when her partner came home to the house and found the kitchen full of gas that she realized she couldn't smell the gas and discovered that she had COVID-19. She lost her sense of taste and smell, which a number of people who have suffered from COVID have reported, and indeed today still suffers from what's been dubbed long COVID. She said in an interview with Sulian, I'm 33, but I feel like I'm 90. I feel like I've turned into an old mummy, an old woman. And I use that anecdote, that personal story, simply because when we talk about the tens of thousands of people who've been affected in French Polynesia, we often forget the very human element of those who've been infected with SARS-CoV-2 and its variants and who are living with the consequences of that. The importance of the situation is such that French Polynesia has very high rates of COVID in a very short time. For a country with over 280,000 people, the Public Health Service has reported 45,000 cases plus of coronavirus since March 2020, and 629 deaths. By global standards, compared to much larger countries, that's not a huge number, but it's an enormous number for a small island state. And just as a comparison, I've listed some of the data comparing the death rate in French Polynesia from COVID to other countries. When you look globally, French Polynesia has a death rate per million cases that ranks at 16th in the world. In comparison to France, a much higher rate, and certainly to the nearest countries in the Pacific Islands. New Caledonia, which has seen a massive surge since just August, September this year, and Fiji, a country with a comparable rate of illness to New Caledonia's, are ranked 91st, 92nd in the world in terms of per capita death rate from COVID-19. Important for all the epidemiologists out there to qualify these sort of figures. French Polynesia, like the other French dependencies, has very good reporting and good data. The Public Health Service of the Ministry of Health in French Polynesia puts out regular bulletins every couple of days with very detailed information, much better than comparable independent nations in the Pacific in terms of the transparency and so on. But even the National Statistics Office in Papeete acknowledges that the death rate is the recorded death rate of people dying in hospitals, and they believe that the numbers are much bigger. So the issue about transparency and openness of data in this pandemic is very important. But on whatever measures you use, it's clear that for a country of 280,000 people, there's been a terrible impact and tragedy in French Polynesia in recent months. It's really striking to talk about the legal context for this, and I want to talk today about borders because one of the features of the pandemic has been that many smaller island states have had few or no cases of coronavirus infection in the last 18 months. And French Polynesia, like New Caledonia, Wallis and Futuna, is what the United Nations describes as a non-self-governing territory. It's a dependency of France. In 2013, a resolution moved by Solomon Islands, Nauru, Tuvalu before the General Assembly saw the reinscription of French Polynesia on the UN list of non-self-governing territories. It falls now under the mandate of the UN Special Committee on Decolonisation. Although the resolution in 2013 really angered France, and they refused to report to the UN under Article 73E of the General Assembly's UN Charter because of their anger over this move by smaller Pacific nations to support the right to self-determination in French Polynesia. France, by the UN under international law, is recognised as an administering power. There's a whole broader discussion about political status and representation, which I don't have time to go into today. But I think it's important that the UN, important to say that the UN has been very much focused on the responsibilities of administering powers in this context for healthcare during the pandemic. In August, UN Secretary General Antonio Guterres made a major speech to the UN Special Committee talking about the responsibility of administering powers around health and welcoming and encouraging efforts to distribute vaccines to the territories. He says we must ensure that no one and no territories are left behind in the fight against the pandemic. Of course, France claims sovereignty over French Polynesia under the French Constitution, which Article 1 talks about France being an indivisible republic. French Polynesia is seen as what's described as an overseas collectivity. It used to be called an overseas territory, but after 2003 reforms, there's a new political status for what used to be called the Dom-Tom network, the overseas departments and territories, as France has dependencies in every ocean of the world. After those reforms in the early 2000s, French Polynesia was granted a new autonomy statute, which came into force in 2004. And that autonomy statute sets out the division of powers between l'État, the French government, the French state, and the locally elected government of French Polynesia, the local assembly of French Polynesia, which is currently led by President Edouard Fritsch of the Tapura Huiratira Party. Related to our discussion today on COVID, the government of French Polynesia has authority over health issues under the 2004 statute, although it's extensively supported, particularly financially and with technical assistance from France under a decade-long strategic health plan. And that's significant at a time where France itself has major challenges with COVID. There's been more than 6.8 million cases of COVID in France and nearly 115,000 deaths. So metropolitan France itself faces significant challenges at this time. Going back to the beginning of the pandemic, in early 2020, Pacific countries around the region closed their borders as the first news came through about infections, for example, on the Diamond Princess in Japan, a cruise ship there, the Ruby Princess in Australia, and other reports internationally of the spreading pandemic. This is Mina Sage, who's one of French Polynesia's representatives in the French National Assembly in Paris. Madame Sage returned to Tahiti on the 7th of March last year, 7th of March 2020, and within a few days was diagnosed as the first case of COVID-19 coronavirus infection in French Polynesia. On that same day, the 7th of March, the other major case in the Pacific, the first case, was a cruise ship passenger returning to Hawaii from a cruise in the region. For the record, the first tragic death in the Pacific Islands came in Guam, US territory of Guam, on the 22nd of March last year, after cases of COVID. And I think it's striking that French Polynesia, Hawaii, Guam, all dependencies or states of major powers like the United States and France, colonial powers in the region. And that's that question about the capacity of island states to control their borders is very much part of this discussion. There was a very quick and early response by the government of French Polynesia, and this timeline taken from the government crisis cell that they established at the time shows very rapid response. I won't go through all of it, but as with other countries, they took very similar steps to independent island nations in the Pacific, closing borders to international travellers, bringing in quarantine systems, and indeed general lockdown. A curfew was declared here on the 26th of March. Schools were closed in the early days, and flights between Tahiti and the outer islands were restrained at the beginning. It was a significant and successful attempt to stop an initial surge of cases, so very small numbers at the time, but as you can see, by April, basically the first few cases of people coming in at the borders had been brought under control, and in April, May, June, there were few, if any, cases of COVID-19 recorded by health authorities in French Polynesia. There were incidents, for example, in May 2020, a French Army plane, ironically bringing in a health team that had flown through Perth in Australia, through New Caledonia, arrived, and the pilot of this Army plane was initially tested and found to have COVID-19. So there's been a lot of discussion about whether French Polynesia has the border controls needed to deal with returning nationals, tourists and others arriving in the country. It also highlights, I think, the issue about the military as a vector for transmission, where we've seen other cases, for example, in Guam, where there was a major incident in March 2020 where US sailors were offloaded from the aircraft carrier Theodore Roosevelt. Yes, I can see a hand's been raised. Judy, did you want to intervene at this stage?
I saw that a hand had been raised, but I didn't see who it was. Did someone want to ask a question at this juncture? Okay, no, keep going, Nic. I think it might have been a mistake. If you do have questions, please do put them in the Q&A box at this stage. I think that would be best. Thank you.
Thanks very much. So as I say, these examples about maintaining controls on the border are very much tied to the political status of French Polynesia as a non-self-governing territory. And a number of legal scholars and academics in French Polynesia have written extensively about this. And I want to acknowledge the work of Hervé Romana Lalamomoy, one of the people I've interviewed about the situation. And as a legal academic and a jurist in French Polynesia, he's written a lot about the tensions between what he calls local and national laws, the laws passed by the government and assembly of French Polynesia, but also French laws, which in many cases can override local legislation. The Statute of Autonomy passed and amended since in 2004 under Article 14 sets out the powers of the French state. And certain of those, such as France's responsibility for the guarantee of public freedoms for all French nationals, maintaining public order, authorising operating air links, and rules related to administration and organisation of local government, of the commune, local government municipalities, which come under French rather than French Polynesian authority, all have relevance for responding to the pandemic. So French state jurisdiction over public freedom, which is entrenched in the French Constitution, can have important implications when the local government brings in diverse pandemic responses around things like border controls, quarantine, curfews, vaccination passports. And Lalamomoe has argued that both Paris and Papeete have worked together to issue decrees in parallel in response to the pandemic, and there's been relatively good collaboration, but there have been tensions where the administrative tribunal in French Polynesia has ruled that some local regulations are illegal under French law because they breach constitutional protections for French nationals. So this has implications where the government of French Polynesia, for example, may be able to ban or regulate visitors from overseas from other countries, but may be constrained about limiting the arrival of French nationals in Tahiti because of constitutional guarantees about public freedom and public movement. That's evident literally today. I'm reading in the papers where France has introduced vaccine passports, which will limit access to many public spaces, to restaurants, cafes, and so on, to people who've been double vaccinated and have to have evidence of that. That has entered into force in New Caledonia, but it's been delayed in French Polynesia. French Polynesia introduced proposals to bring in a fine in a law passed in August this year, a fine of 175,000 French Pacific francs for people who breach this law over a mandatory vaccination to enter public facilities and so on. That's a fine of about $2,300, so quite significant. There's been a lot of resistance to this. And just yesterday, President Edouard Fritsch has delayed the imposition of these regulations until the 23rd of December, rather than the 23rd of October when they were due to start, simply because there are both technical and legal problems about implementing the French passport in French Polynesia. This tension has played out in the economic sphere as well. France reopened its borders to other Schengen EU countries in June 2020 and announced that it would open international borders in mid-July. President Fritsch was very eager to have this happen because of the economic reliance on tourism for French Polynesia, as well as exports of fisheries and pearls and things to countries like China and Hong Kong. President Fritsch said that, fortunately, many American tourists in the first wave of cases in 2020 didn't cancel their bookings to come to French Polynesia. It's classified as COVID-free at that time. And as he said, rich Americans want to come here. This is really important for the national airline Air Tahiti Nui and so on. And so the opening of the borders in July, having had very few, if any, cases in the previous months, really created a significant problem. Strikingly, not only returning nationals from France, Tahitians and others returning to French Polynesia, students, workers, and so on who'd been in France, there was a surge of tourists from America. This is Kim Kardashian West, who people may know as a famous celebrity, who organised her 40th birthday party on Brando Resort, an island. She at least had the grace to get everyone had health screens before they came, but many of the American tourists arriving in French Polynesia at that time were not properly vaccinated. And so you see a major surge of cases from July till the peak of cases where by November 2020, there were about 391 cases a day over a 7-day rolling average. The peak on the 2nd of November was 1,300 cases a day, which for a small population is a significant number. As you can see from the graph, there's been a second surge recently from the end of July this year, particularly with the Delta variant, much sharper, steeper curve, both up and down. This is Michel Bonvoisin. The question of tourism, of economic challenges because of the pandemic is something that French Polynesia has faced, like every other Pacific Island country, and indeed like countries like Australia that have a major interest in international arrivals, both for labour, for technical assistance, for tourism, for economic activity. You know, before the crisis, Air Tahiti Nui, the national airline, had about 9 flights a week going to Paris. Mon Voisin said in an interview that they had lost 8 billion Pacific francs. That's about more than $100 million Australian in 2020. They put off more than 20% of their staff because of the loss of flights. And just indeed in the last week, there's been a $100 million subsidy from the French state, the government of French Polynesia, to keep the airline going. And the National Statistics Office has put significant, shown data of significant economic loss last year. And I think the figures for this year will be not much better. 7.6% drop in GDP, much worse than the 2008-2009 global financial crisis. It's seen also a significant decline in household consumption. The export of goods and services has been halved, and a massive loss in tourism and other revenues, particularly impacting on employment in French Polynesia. Fast forward to July this year, President Emmanuel Macron, who is seeking re-election in April next year in the French presidential elections, made a long-awaited visit, twice postponed, to French Polynesia. This is him pictured in the Marquesas Islands with Joël Frébault, the mayor of Ivaoa, the island he visited in July. Macron made a 4-day visit between the 24th and 28th of July this year with a number of purposes to reaffirm his Indo-Pacific policy, a strategic policy, which we can talk about later in question time, I'm sure, and to reaffirm the importance of vaccination. Big disputes within France about mandatory vaccination policies, about the social and economic costs of vaccination, as is occurring in every country. The first place that he visited on the first day of arrival, literally drove from the airport to Taone Hospital, the main hospital. He's pictured here with President Fritsch and the Minister of Health directly behind him, speaking to health workers at the hospital and calling on people both in France and in French Polynesia to get vaccinated at a time where there's both hesitancy, complacency, and indeed some resistance to vaccination. I might just pause and if we could play a very brief video for the just a sec. Macron was in election mode, and he's here literally kissing babies in downtown Papeete. In a triumph of PR, the baby that he's holding is named Emanuela.
C'est vrai?
Is that true? Is that Emanuela, he says?
Ici, c'est Emmanuel. Super. Bon. Merci.
Okay, thank you. I just wanted to show that brief shot to highlight that you know, the French president was in electoral mode in the middle of an election campaign, literally kissing babies, as we say. And one of the concerns of many locals was that his short 3 or 4 day visit created a context where large crowds were gathering, where people were organizing cultural performances. His visit to the Marquesas Islands was the first visit ever by a sitting French president, ever in history. There were major crowds gathering in Tahiti in the Marquesas. He also traveled to the Tuamotu archipelago, to isolated islands. He traveled to an island called Manihi in the Tuamotus, and with a large entourage coming with him, media, public officials, his own entourage of bag carriers and officials and so on. Many health officials were concerned that this would create a super spreader event. And indeed that was the case. And within days of him leaving, there was a massive spike of cases in French Polynesia. It really created a crisis system. So President Fritsch, Health Minister Reynal, President Macron together at Taone Hospital. By August, this is the main foyer of the hospital, which had become an extra ward with bedding and beds and equipment and so on laid out in the foyer of this beautiful hospital building, simply because of the stress on the hospital system. People in Australia will understand this as a significant dilemma. And this crisis in the health system, particularly peaking in August, late August, September, was manifested in a whole variety of ways, with medical evacuations from the outer islands to Tahiti because of the lack of extensive specialist healthcare and intensive care beds in the outer islands. Indeed, medical evacuations from French Polynesia to France of some intensely ill people, and quite an elaborate cost to move some patients from intensive care in Tahiti to Paris. A major stress on health services. During the first wave in 2020, France deployed a number of specialist medical staff and nursing staff to French Polynesia to assist. However, during the second Delta surge in July, August, September this year, there was a problem because there was a similar surge of cases with the Delta variant in other French dependencies in the Caribbean, where you had in Martinique and Guadeloupe, a major problem. And so France literally didn't have enough doctors and nurses to spare at the same level that they did during 2020. So doctors in the hospital sent out on social media this meme where you had the picture of Macron at the bottom on the 24th of July, speaking about the importance of vaccination, and a month or so later, the same spot being a hospital ward with the president speaking to patients who were there. This has led to a really tragic surge of deaths, as well as illness and long COVID. And one of the striking features of the peak, the first wave of coronavirus infection in French Polynesia lasted for a long time, from basically early August 2020 up until February this year. And as you can see, there were deaths right across that period, but fairly low levels. What's been striking about the latest surge from when Macron left, the 28th of July, right through September, August and September, very rapid decline, which is very positive news because of great steps that were taken by local health authorities and supported by the French state, but still a very stark death rate. And the numbers are really, really shocking for such a small country. And I think it's important to acknowledge the incredible work done by health workers and affiliated staff in French Polynesia, just as we must celebrate everywhere around the world. This is Adelaide Tamuku, who's one of the members of the COVID unit that's been created within the Public Health Service of the local French Polynesian Ministry of Health. Her role in the crisis unit has varied over time. In April and May last year, as the first cases emerged, she was involved in community education work, explaining about masks, about social distancing, about washing your hands, as we did in those days, and so on. In July and September last year, she was involved in phone information for people arriving in the country, talking to people about quarantine requirements, about the need for testing on arrival at the airport and so on. During the peak crisis, working as part of the crisis team to go out at local government level, working with local municipal councils to educate people in the community who don't have good literacy, say in French, or who don't have the luxury of being able to take time off from work to protect themselves. Related to this, of course, is vaccination. French Polynesia has used vaccines provided by France, particularly the Comirnaty Pfizer jab and the Janssen jab from Johnson & Johnson. As you can see, the figures are pretty good from a late start in January. Just by this week, more than half the population has been double vaxxed, and 154,000 people have had their first dose. There's a significant debate, as in Australia, as in many countries, about moving beyond the low-hanging fruit, how to do education to encourage people to take the vax. The photo is of Miss Tahiti, who rolled up her sleeve to publicise the importance of vaccination to a sceptical public that's sometimes wary about French doctors. I think we have to remember the history of medicine and health in French Polynesia because of the nuclear legacies. After 193 nuclear tests, where there are incredibly high cancer rates. French Polynesia has one of the highest rates of thyroid cancer, for example, amongst women in the world. And there's I must say, among some people, a skepticism about the authority of doctors, given that French authorities for many years said that there were no health hazards from exposure to ionizing radiation from the nuclear tests. So to rebuild trust in the health system, in health nurses, in that colonial context, in the legacy of the nuclear context is very important. So as we speak today, this vaccination campaign is a very important part of the ongoing response. The latest surge has been brought under control through vaccination, through outreach, through community education. But as we all know, will reopening the economy to tourism, to further economic activity, bring out more surges of COVID in coming months? Time will tell. Covered a lot of ground, but thank you very much for your time and attention, and hope we can have questions and discussion at this stage. Thanks a lot.